And Priya should be on and able to kick off from the interim secretariat side when you're ready, Carolyn. We had a quick back and forth. Terrific. And then I'm happy to join in if there's any perspectives she'd like me to touch on, but the big thing is for us to hear.
Right. So it's welcome everyone. It's 11. We're going to give about another minute or so as people are still joining, and then we'll start.
Priya, you're Charlotte Ampere. Do you know that?
Sorry?
No, Charlotte. Priya is showing up as Charlotte Ampere there.
Yeah, I don't know why. I don't know why that happened. I'm just changing it. I think because for some reason she said, I don't know. It's okay.
Look, I'm calling myself fifth secretary just so that when I make comments, that people know where it's coming from. I work for Priya on this job, though.
Maybe I should change it as well. Fifth secretariat, interim sec, but then it's a bit long, no? Okay, I'll change it. Secretary.
Sorry, I had trouble getting off mute there. Okay, we have 91 participants on the line and ticking up, so I think we more than have a critical mass, although I think there were close to 300 people registered for this, so I know others will be joining, but we have a full agenda, so in the interest of time, we'll get started. Welcome everyone, thank you for joining us from wherever you are. I'm Carolyn Reynolds, I'm co-founder of the Pandemic Action Network. Welcome back to those of you who joined us a couple of weeks ago for the first round of consultations on the new Financial Intermediary Fund for Pandemic Prevention, Preparedness, and Response, lovingly known as the fifth Pandemic Fund that's being established at the World Bank imminently. And we're very pleased, together with our partners, as you see on the screen, EANNASO, CISDI, and WACI Health, to convene these consultations for global civil society organizations to inform the direction and priorities of this new, very new, important fund. And we're pleased to have colleagues joining us from so many countries. Today's consultation, which we'll go over the agenda, and my colleague Rosemary Mburu, who will lead us through the agenda, will focus on the scope and priorities of the fund, and we're also going to have an opportunity to talk about the civil society, call for nominations for civil society seats of the board. But first, just a quick recap on where we are and the ground rules, and then I'm going to turn it over to colleagues to say a few words. So just brief recap again, because some of you are coming into this conversation for the first time. On June 30th, the World Bank's Executive Board approved the establishment of this new pandemic fund, and which its purpose is to mobilize additional funding and additional long-term funding to strengthen the capacity of low and middle income countries to prepare for pandemics. We've provided you with a lot of background information on this, so please do avail yourself of that, and my colleagues will put in the chat. We've created actually on our Pandemic Action Network website, we've created what we hope is a useful hub of information, pulling together the information and readouts of these consultations, materials that have been provided by the Interim Secretariat and others. We also have a very useful tracker tracking funding pledges so far to the fund, so hopefully you'll find that as a good resource. Since the beginning of July, the founding contributors, founding investors in the fund have been meeting together with the World Bank and WHO as an interim secretariat to stand this up, and it's all moving very quickly. Civil society has not really been in those conversations, but we've created this, that's why it's important, we've created these platforms to open up that conversation and help shape and advance those discussions. And so we are pleased that there has been some progress on some of the things that we've been calling for and that came out of our previous conversations, including related to seats on the governing board for civil society. So I'm going to, and we heard really loud and clear from you all on the last one that that feedback loop is really important. So that is part of what we're providing today. But first, some ground rules. We've got a large group again, so really want to be respectful of people's time. So we have some time limitations. We're asking you to really just keep your remarks to about 90 seconds. This is a CSO consultation, so if you're not a civil society organization, then please refrain from contributing. We do have a lot of, hopefully, I haven't seen the whole list, but we do have a number of governments and philanthropies and other investors in this fund, so on the line. So deliberately so, we're asking them to listen to this conversation and hopefully take that back into their consideration. And if there are any media in the room, please contact our Pandemic Action Network staff offline, and we can respond to questions that you may have. We've asked you to update your Zoom name, so if you haven't done that yet, country, name, organization, please turn on your camera. We're going to ask you to raise your hands to speak. All in the first part, we're going to actually take questions by the chat in the interest of time. Please stay on mute until you're called on, and keep your interventions brief, as I said, and one speaker per organization. I would really ask, I think, for those who, to really give some space for more or for other organizations to speak. So if you've already done so, please, if you can hold back so that we can get as diverse a group as possible. And then we're going to be capturing your feedback in lots of ways, as we did before on the chat, through a Jamboard, through some real-time readouts, and a summary after the fact. And hopefully you've seen the summary from our last conversations. And also a written survey we'll give you if people want to add more written comments afterwards. So that's a lot, but we have a lot to cover. So with that, I'm going to turn to, as we said, we wanted to create a feedback loop. And so we've asked representatives from the Interim Secretariat, from the World Bank and WHO, as well as from representatives of founding donors, to join this call and give some sense of how they've responded to feedback they've received so far, and kind of an update on where we are and where it's going. And sorry, we jumped ahead, but that's the quick timeline on the fund. So let me turn it over to Priya Basu from the World Bank. Priya, take it away.
Thank you so much, Carolyn, and partners for organizing this. On behalf of the Interim Secretariat for the FIF, we're very grateful for this opportunity to interact with civil society organizations. Equity and inclusiveness are central principles underpinning the FIF, and so we really welcome these consultations, and we look forward to hearing from you on how the FIF can, once and for all, help break the cycle of panic and neglect, and also make sure that low-income and middle-income countries, are better prepared for the next pandemic. I'm also very happy that we have representatives from our founding donors here today. The Interim Secretariat is, of course, here to help and support the setup of the FIF, but the decision makers are the founding donors, and so it's great that Arjun and Eduardo and others are here. And also that Bruce from the WHO is here. We're working very closely with the WHO. The Interim Secretariat includes WHO and World Bank, and we're working as a seamless team. So as Carolyn mentioned, we've been hearing you, and we've been incorporating your voice and your ideas into the FIF's governance arrangements and design, as we've been discussing this intensively as a group over the past couple of months since the World Bank's board approved our proposal to establish this FIF. And on the governance front, equity and inclusivity have always been front and center in the design principles. So happy to share that the latest working proposal, the proposal that we're taking forward, all of which would be endorsed and finalized at the meeting of the FIF Governing Board on September 8th and 9th. Includes 2 seats for CSOs, with at least one of them a CSO from the Global South with strong expertise and experience in operational work in the PPR space. We've made a lot of progress over the past weeks, and we've been discussing that with you through various fora, including the two that were organized by PAN and partners a couple of weeks ago. Since then, where we stand is that we have an overall agreement among the founding donors on the structure of the board and its composition, which reflects an equal balance between donor countries and potential recipient countries, because the voice of recipient governments, of what we're calling co-contributor governments, is also super important in all of this, and a board that includes the voice of civil society, a seat for our foundation philanthropy, non-government donors. The FIF is a flexible structure, and so we start with this structure, but the founding donors are very committed to maintaining that principle of flexibility, and so therefore we'll kind of reset the board in a few months. We have already new donors that have expressed interest that will be coming in over the next couple of months. The meeting on September 8th and 9th, one of the primary goals of that is really to endorse the constitutive documents of the FIF. And we will invite at the meeting all of the participants that I mentioned, the stakeholder groups, the donors, the recipient country representatives, foundation, civil society representatives, CSOs. We recognize that some of you, the new kind of board members wouldn't have had an opportunity to look at the detailed documents that are still being negotiated. So we'll make sure that ahead of the board meeting, we will have a prep session where we'll go through the interim secretariat, will run through the constitutive documents with you all, so that whoever is representing civil society on the board on September 8th and 9th doesn't see the documents for the first time, but they're still work in progress, and we'll share them as soon as we get to a point where they make sense to everyone. And those documents are the FIF's governance framework, its operations manual, the contribution agreement template that's signed with each contributor between the World Bank as trustee and the contributor, and financial procedures agreements with implementing partners. So that's where we are. Hopefully there'll be no surprises when you see these documents. They really do reflect your comments and very rich feedback. And let me now pass on to Bruce in case Bruce would like to add something. So thank you again, and very much looking forward to hearing from you.
First of all, just thanks to everyone on the call for getting on today and for your inputs from the last time. Yesterday, we had over an hour and a half with the CSOs from a little further east of where you are all. And I have to say, incredibly rich, incredibly timely discussion. So today is super important because, to be quite frank, most of the discussions so far have been who gets to make a decision, how many people vote, what's the voting process, what's the minimum threshold for donors to be on a seat, et cetera. An awful lot of the discussions, and Arjun, you've been sitting in these meetings, with these painful meetings with the founding donors, are really about how they work together and which of them joins with which other ones of them on constituency seats and things like this. And I just want to demystify a little bit those meetings, because quite frankly, the big issues that really matter, the scope, the priorities, the order, what this pays for, et cetera, those are the things that are really going to be discussed more as we go forward and come out in the calls for proposals, et cetera. Yesterday, we had a fantastic conversation, I have to say, with the CSOs. Lots of great insights on the scope, what shouldn't be in scope. Lots of great ideas about priorities. By the way, there were a lot of good ideas about what it should do. There weren't enough ideas about what it shouldn't do. And if we don't get more of that from people like you today, we're going to have a problem, because we're going to be stuck spread too thin and not closing the critical gaps. So that focus today would be really, really important. Just to add a couple of words to what Priya said. When you met in the middle of August, was really important, because then we had a number of intense meetings with the founding donors. And because we had such rich and powerful input to bring from the CSOs, it really shifted the discussion about the importance of making sure these voices are heard. So we got quite quickly to the idea of members of the board voting, non-voting, then became the issue, which frankly is almost a second order issue. But it made a difference to the point that Priya highlighted. And I just want to appreciate that, because you made our job easier, making the case for you, made Arjun's job easier, because the US has been a great champion for CSOs. So thank you. And it's why today's conversation will be important as well. The other thing I wanted to mention, Carolyn, just so people know, a lot of the conversations we have is, where are the donors on their contribution agreements? Where are implementing entities on their finance procurement agreements? You know, this is really nuts and bolts of the mechanics of getting the legalities in place so that you can actually hold a board meeting. And that's why, again, you know, yesterday, one of the questions were asked, well, why aren't CSOs, you know, in the founding donor meeting? This is a meetings between them about how they're going to work together. Then the board gets constituted, and the board will discuss how it's going to work together. As Priya said, everything will be in draft, and CSOs will be at the table. So there'll be a great opportunity from next week. And I think looking forward that way is really positive. So the time today, let's jump in, hear your ideas about scope and priorities. Any questions you have to us, I think, Priya, we're delighted to try and help and clarify. Always take Priya's word, by the way, not mine, because I'm you know, she ultimately hosts this and the bank does. So we have to work to their processes, and we're still learning a lot of those, but it's been a great relationship so far. A couple of little points that happened since last time that you guys met. First was the number of donors, as Priya mentioned, has increased. We're up around 20 now, and a little bit more when you look at people who want to come in. So, you know, more than a 30% increase since we met you last. That's a great sign. The second thing is starting to lock in the board shape, you know, 9 donor countries, 9 I call them non-donor countries, but you know, the co-contributors, we call them, because they're important. So to balance that, et cetera. So it looks like we'll probably land around 21 board members. So that's getting a little bit more sharpened up. Also, the idea of how the, you know, there'll be interim members, because there won't be enough time to go through a self-selection process fully with like the non-donor countries, to call them that. So we're going to try and identify who can step in for the first board meeting and then run a process. So we made a lot of, I think, progress in that area. But and then let's just jump into questions, Carolyn. If people have any specific questions, just try and demystify any of this. But the real point for saying blah blah just now is really thank you. That's the big message. You're being heard. It's making a difference. It's gaining a voice and seat with the fifth where you have to be. So thank you for everything you've done and for the conversation we'll have today.
Thank you, Bruce. Thank you, Priya. Really helpful, both feedback, but also more information about where things are, the process to date, what's to come. We're getting some questions in the chat, but before we go to those, I'd like to invite Arjun Thompson from the U.S. Treasury. Obviously, the U.S. is one of has been a leading force behind setting this up and major contributor to this. So wanted to ask Arjun just to give, you know, add to what you all have been talking from the perspective of a donor, and then we'll take further questions. Arjun?
Sure, thanks, Carolyn. And nice to see many of you and be here today. Thanks, Bruce and Priya. I don't have much to add on top of what they already said, but let me just mention a few things. I want to re-emphasize the point they made about flexibility. And you know, from the perspective of the founding donors, you know, at least from the perspective of the US, we know that this is a very fast breakneck process. And we are asking a lot from you all, from other countries, co-contributors, the World Bank and WHO. And a lot of it is driven by the urgency on our end to obligate that first $250 million of funding from the State Department. So we understand the position that we've put many of you all in, and very grateful for the cooperation and speed at which we've been moving forward. I think as Bruce alluded to, you know, the focus of the discussions to date has been on how the donors will sort of work together and managing that dynamic and making sure that the minimum governance structure that's necessary to stand this up and be able to contribute our funding is in place. And a lot of the operational issues would be addressed with you all and others after the first board meeting. So just to say that, September 8th, September 9th, that is not the end of the road. It is very much the beginning. And beyond this, there will be, we would like to see continued ongoing engagement with the CSOs, in addition to the representation that they're likely to have on the board itself. And I will just say, these meetings are very helpful for me personally. Last week, the State Department organized our own CSO consultation, and I was answering some questions there as well. And hearing the feedback from folks on how the fifth can be more transparent, how the governing board can better communicate, questions around voting and priorities. These have all been internalized, as Bruce and Priya have said, and so you are making an impact in that sense. And just to finally wrap up here and just say that the U.S. has been pushing very strongly for 2 CSO seats from the beginning. It's been a journey to get to where we are today, and we can discuss more in detail if folks have more questions on that. But I think we're optimistic in terms of how things look, and like Priya and Bruce said, next week will be the time when the governing body endorses these documents, and that's when things actually become final. But it's been a pleasure working with them on this issue and hearing from you all. So thank you very much, and looking forward to answering questions.
Thank you, Arjun. Thank you all. Okay, so we have actually some really specific and good questions in the chat. Let me summarize that, and I'll throw in one of my own, and then maybe we'll go for one more round. So questions about, to your point about flexibility, and related to that, about where the size of the board will land, but also that question of whether, good that there are at least 2 seats on the board for civil society. As we know, there are other global funds and initiatives that have more than that, thinking about community representation. So it's kind of a bigger point of, is there room for this to be flexible going forward and to grow? There's questions about the number of donors and recent donors who have joined. Bruce, you spoke to that a little bit, and we have been doing our own tracker, but suffice to say, there hasn't been a huge amount of transparency on all of that. Some have indicated that they will be pledging, but have not done so yet, but they're in these conversations. Some have not necessarily been announced in any public fora. So any clarity on that, and it goes to that underlying issue of how to ensure greater transparency of this going forward, I think, because of course, we don't just want more money, we want more additional money that isn't being taken away from other priorities, and so making sure that that is happening. There's yeah, well, I was just saying, there's also a question on the sort of how much of the funding has been from non-ODA. So to that, I don't know if you all can speak to that. And so those are a couple of the questions, and this threshold level for donors to join the board. I know that's been a lively discussion, so, and country ownership. So I think I got the main questions in the chat, but if maybe Priya, I can turn back to you, and then Bruce and Arjun.
Sure, thanks, and great questions. So actually, one interesting thing about this fifth is that there isn't the traditional donor-recipient divide that you have in some fifths, because some of our donors are actually developing countries, and so far, there's been 17 sovereigns and 3 CSOs, and I think that information is all known. And the sorry, not CSOs, 17 sovereigns and three foundations or philanthropies. So so that information is out there, and these are the ones that have pledged to provide resources. And then over the past 48 hours, there's been 2 new donors, 2 new sovereign donors, one a developing country and one an OECD country. I don't want to steal their thunder because they haven't made public announcements yet. So, I think they're waiting for the right opportunity to announce. So I just don't feel right to kind of, take it away from them. But I can tell you one of them is a developing country, and the other is an OECD country. And so that takes our developing country donors to, we already have Indonesia and South Africa and China. And then this would be the fourth developing country donor. And then the other one is a G7. And on the breakdown between non-ODA, the breakdown between ODA and non-ODA, so of the roughly a little over $1.3 billion worth of pledges that have been made so far, 42 million equivalent is from philanthropies and foundations. And the rest is from sovereign donors so far. But it would be great to see more philanthropies and foundations, including ones from the Global South, contributing. So I don't know if that answers some of the questions that were raised, but I do want to emphasize again that it's as Arjun and Bruce mentioned, all the discussions so far have been mostly about how these donors organize themselves, but the really exciting part is going to be how this fifth can actually help low and middle income countries strengthen their PPR through calls for proposals and through allocating funding for really good projects. And that whole process, will really start in earnest in September. So between September and November, we will work, on designing the first call for proposals, and your feedback and input from civil society will be really valuable in defining, how the fifth kicks off, by through its first set of projects. And just one more question, just to anticipate, because this came up the other day. It was 3 a.m. for me, so I was half asleep. But I think the question was, what will be the timeline for disbursement? So the way we're thinking about it for first disbursements. The way we're thinking about this right now is that, the first call will be issued, the first call for proposals will be issued around November. And then 3 to 4 months would be given to prepare those, the projects which will be submitted then to the fifth, and the board would have to approve them based on advice and recommendations from the technical advisory panel. So, with that timeline, the first set of disbursements to projects will probably happen in kind of early next year, say February, March next year, but probably not before then. So thanks.
Great. I don't know, Bruce, if you wanted to add anything, and then Arjun, I see, has his hand up as well.
Sure. And first, to the point someone just made in the chat about challenging the term developing country, great. And in fact, in the board, we discussed, the donor countries and co-contributor countries, recognizing that that's such a vital part of this. And apologies, we use shorthand all the time, and it's inappropriate, and call us on it, and we'll get it right as we go forward. A couple of questions just in the chat. There was a point about the 2 CSO seats, and I think that we need to remember right now, when we look at the non-donor seats, that's 20% of the seats at this point. It's a small board, and the idea is keep the board very small. That is the goal. But really as well, this is going to work in a way in terms of either consensual decision making or super majorities, that those couple of seats will make a big difference. So I'd be really at this point, I think we've come a long way given the diversity of donors and founding donors, and I think we've had a major score, frankly, for CSOs and the value and the voice. And I know it's not where ones would like it to see, and would like to see even better balance, but from where we started, my goodness, it's and again, the work you guys have done and the reports you put together have really helped move that. That's why Carolyn, I want us to get into the scope and priority, because that's what people are really interested in. And if you demonstrate the value on that, it'll just make the argument more powerful. There was a question on Latin American donors. I didn't hear you respond to that, Priya, but we don't have a confirmed Latin American donor at this point. We have been in discussions with a number. Brazil has asked us a lot of questions, and we've had a lot of discussion, but at this point we're not there yet, unless Priya knows something I don't. But I think the important thing is, remember as well, Mexico did really important stuff by contributing and supporting CEPI. So, we've got lots of donors from Latin America that have been or played a donor role. It'd be great to have them as part of the fifth. A lot of interest, let's say, as well, and definitely not ruled out. There was a question about One Health. Folks, we cannot manage pandemic risks and reduce it without a One Health being super important to this. We've got to be really clear, though. There are, in the prevention agenda, right, there's a whole bunch of, now I'm going to get into our priorities and scope, right? But there are a whole bunch of high impact interventions in the animal human surveillance interface, in the regulation and management of markets and wet markets, in a whole bunch of places like that. People are super and increasingly attuned to that as part of the PPR agenda. So that's positive, moving the right direction. And the One Health voices playing an increasing role, let's say. Not quite where we have to be, but going the right, I always think direction here, we headed the right way. Yes. On thresholds, great question. And I was hoping, Priya, you would answer that one, but I think where we are right now is a diversity of views on minimum thresholds, right? People feel that if we have a minimum threshold, we're going to increase the contributions, et cetera. Others feel it can be disincentive. We're trying to really bring in a range of markets. So what we're looking at right now is, can we have let's say, almost a scaled threshold that may be a function of how big the fifth is overall and what level of development a country is contributing from. For the moment, kind of grandfathering in any country that comes in almost at any level, but no one's below $1 million, which is really important. Otherwise, transaction costs, frankly, start to be too great. So I think we're landing on a place around thresholds, but trying to make it in a way that incentivizes, doesn't disincentivize, and then you immediately get into complexity, right? Like you can no longer say it's 10 million; it's a percent of this, which is a percent of that, and it gets more complex. So that's what we're still working through. Arjun's going to try and clarify some of that. And then there was a question as well, I saw it there, Carolyn, about the network priority and IP plan, which I didn't follow. So if whoever wrote that can just make it more explicit, we'll respond in the chat. Thanks.
Yeah, thank you. Arjun.
Yes.
Oh, sorry, philanthropic donors. Absolutely, yes. There's a seat for philanthropic donors. I should have said there's 9 Southern donors, 1 philanthropic. God, I'm just trying to shut up so that we can listen to you. That's why I'm jumping quickly through some of these points.
There is a question about private sector, which hasn't come up here. So maybe you want to add that, Arjun, if that's come up in your discussion.
Okay, thanks. I was going to,
Yeah.
I was going to talk.
It's
a lot. Yeah, no. And Bruce did such a good job of answering some of the questions I was trying to get at. I think the question I wanted to focus on was actually on like board size, and I think Bruce hit the nail on the head. And in this early year, in sort of year 1, we called for a stock take of how the board works in order to improve it going forward after year 1. And so I think it's important to get the board operations right. And so for that reason, being very conscious of the total size of it and making sure that it is efficiently run. Because like Bruce said, there's a very broad range of views on by the donors in terms of the level of CSO participation, and it's very good that we are where we are today. And so just being frank with you all, not all countries share the same view that the US shares, and advocating for more than 2 CSO seats is just something that probably was never going to, we were never going to get there. And I know that's more in line with the Global Fund. So I think we have to focus on, on the priorities ahead of us right now, which is making sure that the board operations are stood up properly, and this group of people can work together and work towards the outcomes we all care about. After a year, we'll see how that operations goes, and that can be that stock take would inform any sort of adjustments. But on the governance side, and specifically the role of CSOs, I think that there would be a high bar to sort of change that. And Priya can correct me if I'm speaking too much on this. So I'll just pause there. I think Bruce covered the question around threshold well. That's an active discussion on minimum threshold. I wasn't sure maybe around minimum threshold or just the formula for allocating seats. I think someone needs to go on mute.
If you can mute yourselves, please.
But if the question was more about seat allocation, there are, there's a sort of tiered thresholds that could inform single seat constituencies. And that's based on, total contributions and the 9 available seats for donors. I'll pause there. I'm trying to follow the questions in the chat the best I can, but I hand it over to Priya.
Yeah, and Priya, let me have you fill in the gaps, and then we do want to move on to the main agenda items. We realize we won't get to all the questions that have been posed, but rest assured we will capture them all, and we can work offline to get responses from the from colleagues and the interim secretariat and donors and get back to you on that. Priya.
Yeah, so I'm not as good as capturing, as reading all the comments on the chat as the call proceeds, so I may have missed some, but I think one point that I wanted to talk about was how the private sector could be engaged in this, because I think that came up in the chat. And I think we need to think about this more holistically. I mean, in terms of this partnership, moving from the governance to actual delivery. And when projects are prepared and projects are delivered on the ground, and it's the projects that the FIF funds will really make a difference, in terms of strengthening PPR and filling the capacity gaps and needs on the ground, and helping countries, get meet standards, from set by the as per the international health regulations and also the One Health regulations and so on. So there, I think there can be, there should be and there can be strong involvement from the private sector in delivery, through public-private partnerships. So the quality or the final results of this FIF and what it achieves, the quality of the projects that come in, and we would very much hope that the projects that do come in for FIF funding include private-public partnerships where it makes sense, and that's also another level at which CSOs can get involved, because you never, no matter how many CSOs, in a board of 2021, you can have 2 CSOs. That's not going to capture the voice, but 3 is not going to make a big difference, much bigger difference either. So how do you capture CSO involvement more holistically in this partnership? It's not just through having governing seats, it's through CSO involvement in delivery on the ground. And there again, which is why we're sort of seeking involvement of CSOs that have real operational experience in including in fragile and difficult settings, in actually getting services to people. So as these projects get developed, the implementing entities of the FIFs, which would be more kind of the MDBs, UN agencies, and global health organizations, we would encourage them to partner with CSOs as delivery partners on the ground. So once again, I think we need to think of this in broader terms. How the engagement of private sector, of civil society, of other experts can be leveraged in preparing and delivering FIF funded projects, and at the we have some good examples of doing that. And just one more point in terms of civil society voice. So we will try to think of ways to sustain civil society engagement through forums, through through getting through ways to capture the voices of a broad constituency of civil society groups from across the globe, so that that can then inform the deliberations and the priorities of this fifth beyond the CSOs, the two CSOs that are kind of in the governance structure of the fifth. So thanks.
Thank you, Priya. Thank you, Bruce. Thank you, Arjun. Really rich discussion, great feedback. I know we didn't address everything, but as I said, we will capture all of this and try to get responses on all of that, but it all informs the ongoing discussion. So thank you for that, and thank you for staying on and listening. We know there are other contributors on the line, and that's also really valuable that you're listening with us. So we want to get to the meat of our discussion today, which is on the scope and priorities for the fund going forward. As you just heard, this is an opportunity. This is actually really timely because those discussions are just starting, and so this is a good time to have civil society inform those discussions going forward. And so I'm going to turn it over to Rosemary Mburo, who's the Executive Director of WACI Health, and who's going to lead us through the rest of our proceedings today. Rosemary, over to you.
Thank you, Caroline. And once again, I'm happy to moderate the conversation today. It's exciting to see so many colleagues here and to see the progress that we have seen since the last consultation. So today we have, so I know Caroline has introduced me, but I think to say that I'm coming to you from Nairobi, Kenya. I lead WACI Health, which is an Africa regional advocacy organization. In addition to that, I also co-lead WACI Health colleagues together with GFAN and STOPIT, the ACT-A communities and civil society representatives platform. And so we are happy to partner in this and also on the interim CSO representatives selection process, and we'll hear more about that later. So in terms of today, we only have two discussions, very important discussions. We will look at the scope of the PPR fifth. We'll have 30 minutes to look at the scope, and a lot of that has already begun flowing in through the chat, and I know we had a lot of that again yesterday. So very excited to hear what colleagues have and what we think should the scope of the PPR fifth be. The second discussion, we will have 25 minutes to look at the initial RFP priorities. Based on the conversation we have had here, it's important then that we say, where are those capacity gaps? Where do we need to scale up? Where should the priorities be for the initial investments? And then the third conversation, we'll have about 15 minutes to get updates around the interim CSO representatives, governance board discussion, and a lot of that has come in, and there will be updates around that. So without further ado, I invite us to transition to the first discussion. This is the scope, as I had mentioned. There will be 3 guiding questions, looking at what should be in the scope and why, what should not be. We didn't hear a lot of this on the call yesterday, so hopefully we can hear more about that today. And then the third will be looking at how can the fifth scope and priorities legitimately fill gaps in pandemic preparedness at national and regional levels. So this is our discussion today. I know Caroline has gone through the ground rules. Just want to encourage colleagues who haven't spoken, who didn't speak during the first consultation, to encourage you to speak up so that we can also hear from different or a variety or a diverse rich experience of colleagues. So I will use the participants list here to invite colleagues to jump in and share their reflections. So I have Chris Collins, please. Then I think I'll line up 3 of them at a go, and then we can come back to another round of 3. Samantha, Rick, Paul Davis. So we have those 3. Then we'll come back to another 3. So Chris, over to you.
Well, thanks very much for this consultation and for taking my question. I'll go right to it. In terms of scope, I would just say of the 3 areas of investment that have been identified, I really hope you will identify the percentage allocation roughly in each and make strengthened country level capacity far and away the biggest allocation here. It's about making investments in health systems that can respond to people's needs today and be ready to respond and identify new disease threats, and be clear in that funding can go to health systems priorities like community health workers and community systems. Let's learn from COVID. Those were so critical in COVID. Let's invest in them. Point 2 is from the start, strategically define the role for key implementing partners based on their comparative advantages. Today the MOPAN report came out saying the Global Fund has clear advantages in effectiveness, partnership model, agility, alignment with country plans, and financial processes. So I think Global Fund should be one of those things where from the start, identify the role it can play. And 3, related to that, allow for omnibus proposals from key implementing agencies so that the Global Fund, Gavi, and others can bring their strengths to this. If it's only country level applications, those organizations like the Global Fund and all the synergies they bring won't be able to participate. Thank you.
Thank you, Chris. Samantha?
Apologies for any background noise. I'm in a baggage claim. But on our view, PPR fifth disbursements must address the need for robust global investment in research and development into existing pandemics as a jumpstart into research into new emerging pathogens. HIV vaccine research fueled the rapid progress toward an effective COVID-19 vaccine, and ensuring equitable global access to new interventions will require multiple simultaneous policy approaches, donations plus suspending patents, plus technology transfer, plus building manufacturing capacity, plus ensuring easy access to raw materials. Any disbursement of funds should factor into the extent to which the proposed project will equalize access to prevention and treatment innovations and their development. In addition, we believe that any pandemic preparedness funding mechanism must support countries work toward universal health coverage in a way that ensures true universal access to health services across groups and geographies. Pandemics have a severe impact on broad health system functioning, and it is crucial that health coverage is strengthened to withstand the extra burden that an unexpected pandemic can place on routine essential health services. In particular, health workforce strengthening must be a top priority in distribution of PPR fifth funds. Currently, there are very few funding streams devoted to recruiting, retaining, and supporting the global health workforce, and this fund can be pivotal in filling that gap. Thank you.
Thank you very much, Paul. Paul,
sorry, I'm new to this. I'm new to this Zoom thing, apparently. Hi. So thank you very much for the opportunity. Thanks to Pan and the Bank and Gates and everyone else for hosting this. We're the largest grassroots organization of COVID survivors in the United States, have activists fighting for a new global fund against pandemics. Personally, it is my second global fund. I set up a fund to fight AIDS, tuberculosis, and malaria, and we're strong supporters of the GFATM. In debating scope of work, we have too often seen stakeholders make a common error, which is to confuse surveillance with primary pandemic prevention. Surveillance is not prevention. It is by definition something that happens only after an outbreak has happened. We also frequently confuse One Health with a specific program. It too often is not. What we are advocating for is a global fund against pandemics that accepts as one of its key priorities preventing outbreaks, pre-spillover, rather than accepting diseases as unavoidable. Outbreak containment and IHR compliance is urgently important. We support it. In fact, let's add a target. Let's say we're going to meet IHRs worldwide in 5 years in low and middle income countries. But to rely solely on containment is to opt to come in expensively too late with an approach that has been demonstrated ineffective by COVID-19 and now monkeypox. To plan a fund that only sends fire trucks instead of also funding efforts to blow out the match. The containment-only agenda fails in 3 ways, and we'll say what we want. First off, and most importantly, accept that poor people just die. They're used to dying. The world's responsibility begins and ends with stopping the spread of outbreaks. Stopping the spread of outbreaks from typically poor people to typically wealthier people. Embedded in that is the same kind of uninterrogated colonial biases that lead to vaccine hoarding or decades of inaction on monkeypox, which got little attention until whiter, wealthier countries in the West saw the disease. Containment-only agenda sets aside proven, cost-effective, simple measures that tackle the key drivers of zoonotic spillover, and importantly, takes easy, low-hanging fruit wins off the table at a time we need to produce results quickly. So that also is relevant in terms of sequencing. When do we do what is sort of the second question. So I'm just only going to comment once. So I'm going to throw that in here.
Paul, sorry to cut you, Paul. Your time is up. Your time is up. I'm going to move to the next person. You can put additional comments on the chat, Paul. Thank you. So we can go to other three colleagues. We could go to Neil, then Ganjan, and Nigel. So Neil, over to you, 90 minutes, seconds strictly.
Okay, thank you so much. Really appreciate the opportunity to be here. I'm going to echo what Paul Davis just said. I'm a practicing physician with Conservation International. Clearly, there are many priorities for this fund, and I sadly can't tell you what not to fund, and I don't envy your position. But I will say that spillover prevention has to be funded alongside many other important investments, such as vaccine equity. Every pandemic since 1918 was the result of spillover of animal viruses into people. And now we're dealing with monkeypox, which is also the result of spillover. We could not have been more prepared for monkeypox, which underscores that some infectious diseases will fail to be contained no matter how ready we are for them. And so my point is that we must invest in evidence-based actions to prevent spillover. And I'm talking more than just about surveillance. Again, as Paul Davis just emphasized, this is an issue of equity. The tools of pandemic preparedness and response, such as vaccines and therapeutics, are inequitably distributed, whereas spillover prevention protects all people, particularly in resource-limited settings of the world. So I'm also aware that some groups have started advocating against investing in spillover prevention. And I want to emphasize that if the fund does not invest in this, it will ultimately lead to the failure of the FIF to accomplish its mandates. Two more quick points. Many of the actions to prevent spillover will also address climate change, and that's only going to make pandemics much worse. And furthermore, people in global health often say that climate change funds should be dealing with many of the actions to prevent spillover, but the reality is that the nature-based solutions to climate themselves are underfunded, so we can't rely on climate funding to accomplish the task of spillover prevention. Thank you all so much for the opportunity.
Thank you. Ganjan?
Yes, hello everyone. This is Nilafar Ganjun, tuning in and representing Last Mile Health and the Africa Frontline First Coalition. We know that the FIF aims to build on existing assessments and risks and capacities to prioritize actions and financing needs. However, neither the current JEE nor the 2005 IHRs explicitly include the community health workforce and infrastructure needs that need to be in place for prevention, detection, distribution, and response. The impact that this often invisible and underfinanced cadre of frontline health workers have had on the continuity of care during the COVID-19 pandemic has been seen. So how can we ensure that the whole of the global health workforce are represented? I cannot underscore the importance of investing in this critical cadre of frontline health workers. Over from me.
Many thanks for that. We had Nigel.
Thanks. Nigel Sizer here, Executive Director of Preventing Pandemics at the Source, and strongly support the comments that Paul Davis made and Neil made as well. We represent 20 major global organizations working to prevent future pandemics. I won't repeat what they said, so I'll just add to it. I think one of the concerns that some have had about investing in upstream prevention and primary prevention, which of course is the most effective way to address future pandemics, if you can do it successfully, is that it could take a long time, that there won't be quick wins, that somehow there are quick wins in the response and containment area. Well, last night I sat on Zoom and watched my sister-in-law in Jakarta die from stage 4 AIDS. I wasn't going to talk about that, but I think this is such a relevant example, right? How many decades into this pandemic, the AIDS pandemic, are we watching people in highly accessible parts of the world continue to die from this? It's tragic. Millions a year are doing this, and they will from future pandemics as well. We must immediately increase the investment in upstream prevention so that these tragedies do not continue to occur. We can see quick wins from policy dialogue, the work that we're supporting in policy dialogue between health ministries, wildlife agencies, environmental agencies, to develop stronger regulation of wildlife markets and so on. A lot of this work is very low cost to implement. So we can see some real quick wins, I think, at relatively low cost for the fifth if it gets serious about looking upstream and engaging in primary prevention. Thank you.
Thank you so much. Sorry for your loss and thanks for sharing that with us. I'm gonna go to another round of three, but what we are hearing without, undermining some of the points, but some of the ones that are standing out include investing strongly in health systems, including community systems, strengthening, ensuring that we're investing in health workforce, ensuring that disease spillover prevention is invested in. And so keep the comments coming. We are also tracking those of you who are chatting, and those ones are also very much acknowledged and recognized. I'm going to first invite colleagues from other regions where we haven't had any input. I see we have Annie from Malawi, we have Babasola from Nigeria, and we have Emmanuel Gaza from Zimbabwe. So Annie, over to you.
Thank you, Rosemary. I hope you can all hear me. So I am representing WaterAid and I'm joining from Malawi. And I wanted to say that, according to WHO, maintaining hygiene in healthcare settings is one of the most important measures that can significantly reduce the burden of treating infectious diseases on the health system. So one would expect that hygiene would be a non-negotiable basic for any health system, but no. In 2021, and this is data released yesterday by WHO, half of the world's healthcare facilities lack basic hygiene services at points of care. A quarter have no basic water service, 10% do not have toilets, and many more lack basic environmental cleaning services. Therefore, we should not be surprised that infections are continuing to thrive, keeping health systems weak and increasing preventable deaths. This is something that we can do something about. And I think that this is something that the fifth should definitely do something about. We can all agree that the fifth must ensure that it responds to and fills gaps and weaknesses in national health systems and their basic building blocks to effectively prevent, prepare, and respond to health emergencies and future health threats, whether pandemics, epidemics, or even AMR. Ensuring all healthcare facilities have adequate water, sanitation, and hygiene services is a critical building block of resilient health system. It is not a nice to have. On the contrary, it is a no regrets investment that will help to prevent infections, deliver quality care, encourage healthcare seeking behaviors, and ensure patient and healthcare worker safety at all times. Therefore, the fifth must prioritize ensuring that no healthcare facility continues to operate without water, sanitation, and hygiene, because if it does not do so, other efforts to strengthen pandemic preparedness and response will continue to be significantly undermined because healthcare systems will remain weak. Thank you.
Thank you, Anne. Thank you very much. Let's go to Babasola.
Thank you very much. I hope you can hear me clearly. My name is Babashola Ulugasa from the University of Ibadan in Ibadan, Nigeria. I am in the Department of Veterinary Public Health and Preventive Medicine, and directly work within the Center for Control and Prevention of Zoonosis. What I would like to add to this discourse is the fact that by inculcating academia, especially at the National Zoonosis Center in such densely populated African countries as Nigeria, Kenya, will be so helpful in supporting the coverage of disease surveillance and preparedness at the research level, especially with the fact that there are efforts to combine data at the human-animal environment interface by retrieving digitalized data, hospital records at the human hospitals, and the veterinary hospitals, as well as the diagnostic laboratories in human hospital level and animal hospital level are critical. It's a gap, it's a missing point within the national health system at the moment in Nigeria. And that is one of the cutting edge where it could be early captured, whatever is emerging. And so I think funds like this will go a long way in helping the global coverage and catchment of things that may be emerging at that interface by building that infrastructure where pathogens are actually detected across that divide. So thank you. Let me just stop at that and commend all that is being put together here. Thank you very much.
Thank you. Thank you. Emmanuel?
Yes, thank you so much. Mine will be, it's really critical that with this particular fund, I think we also need to prioritize internally displaced populations. Because looking at change, I think as a continent, particularly as Africa, we haven't actually been doing a lot of good work as far as disaster preparedness for our own populations, which is really something that I strongly feel that is really critical, that we need to make sure that this particular engagement is actually meaningful to our own African population as far as disaster preparedness and awareness is concerned. Then we come again to the issue about making sure that we harmonize inclusion of persons with disabilities, particularly persons with albinism. Looking at climate change right now, I think collectively it's really important to have institutions like African Union and make sure that on this particular fund, to what extent and how best can we safeguard melanin that persons with albinism actually suffer from as a collective, particularly as a continent, because most of them we find actually 70% of persons with albinism, they end up with cancer. So to what extent are we raising this particular preparedness for persons with albinism so that at least we really know that we are actually safeguarding their own future, particularly for young people who are living with albinism. Thank you.
Thank you. Thank you, Emmanuel, for all those great points from all the three colleagues. We can take another round of three. I see we have a colleague from Mexico, Paola. We have someone from Tanzania, CISDI, and we have South Africa, Leslie. So let's go with Paola first. And we'll come back to all of you who have their hands raised up. Just wanted to make sure we have some balance and diversity. Over to you, Paola.
Thank you very much, Joel. Yeah, I would like to first ask you a question about what measures are being considered in terms of proactive transparency and accountability for the operation of this fund, because it is important to consider in the governance structure to consider these mechanisms of transparency, accountability, and oversight. We have seen in these very big funds, we can remember Aid for Food or the ones from for the tsunami or for the earthquakes in Haiti, that eventually these funds could be a problem in terms of accountability and probably risks of corruption. We in Latin America made an exercise before the declaration of emergency in Latin America. 13 countries, we made this chapters from TI. We made an exercise highlighting the possible risks of corruption in public contracting, and it was an early alert, but these risks happened after the pandemic. We have seen this, so I would like to highlight the importance of transparency and how is the fund is going to mitigate these possible risks of corruption. I'm going to include also two papers, one about this risk of corruption in public contracting made in Latin America, and the second one, a study about contracts of vaccines, how is opacity being held in these contracts. So that's why I highlight the importance of this. Thank you.
Thank you. Thank you very much. CISDI?
Asante sana dada. My name is Saidi. I'm from Tanzania, the Executive Secretary of Gift of Hope Foundation, and also chairperson of Tanzania Network for People Who Use Drugs here in Tanzania. My suggestion is not so big, but what I like to know, first of all, I was grateful to you guys to join together in the world to support this kind of epidemic. But my point is community engagement. Also, we better to have a guideline, but it's not about a network to be engaged, fully engaged, where the most problem is. Because we need to know where the problem is. So if we know if we have mapping and we know, oh, this place is a big problem, then it's better to engage in that side. But most community engagement, research, mapping, and database with a guideline. Better to have a guideline as a COVID-19 guideline we have here in our country, but in this one also, better to have a guideline. Thank you. I wish you all the best.
Thank you.
Very good job. Thanks.
Thank you. Thank you so much. So I know I had already called upon Leslie, and I'm also conscious that we are getting to the end of this particular session, but I know we still have many hands up. So if you can maybe do 1 minute, very quick, sharp, rapid interventions, that would help a lot. Leslie?
Great. Thank you so much, Rosemary, and amazing moderation as always. So I just wanted to encourage us for the scope. I'm not going to include all the elements, but what I think is really missing. And I think although there is talk about community and community awareness, there needs to be a lot more around community leadership, community-led monitoring, linking it to the piece that the colleague from Mexico was talking about, the accountability piece. And also community advocacy. I think one of the slides mentioned advocacy, but we really need community advocacy if we want to be prepared for pandemics. We need our communities to be able to advocate for an enabling environment. We need them to be able to advocate for social security. These are the things that make people prepared for pandemics. It's not only the medical and biomedical interventions. So just to really highlight that we need that. As well as community system strengthening. I'll stop there for time.
Yeah, thank you. So for those who have spoken, if we can put our hands down to help us just move very quickly. So we have our colleague from Liberia, if she can go first. Then we have Colin from the US. We go to Giza, Haley and Rabita, very, very, very quick. And we are not able to take additional hands after that. We can go very rapidly. Thank you.
Hi, I'm Jenny Desmond. I work with a founder of Liberia Chimpanzee Rescue and Protection, and I'm also a member of the End Pandemics Coalition. Thank you for having me. And I will quickly run through kind of 3 major points. One is just that I think it will be really key to success to have prevention expertise really high up in the technical advisory panel from the very start and in the Secretariat. I know we focus a lot on response and preparedness, but I think the prevention piece for this prevention, spillover prevention will be really key to have that expertise. I also want to mention, I think I haven't heard a lot about the wildlife field. I know we all know, but we did mention, someone mentioned markets and wet markets and wildlife markets, but also I think it will be really key to have frontline stakeholders in the field of wildlife, such as rangers, law enforcement, people addressing wildlife trade for inflammation on the ground, and also for spillover risk reduction on the ground. And so really the frontline prevention. I know I have 2 more seconds, so I just want to also just give some examples of things that I think might be priorities. That's kind of dipping into the next section is institutions and coalitions such as the One Health platform we have in Liberia. So funding and supporting those kinds of frontline roles and One Health approaches that are being used all throughout a lot of their implementation of our programs. And then coalitions and networks like End Pandemics, and I saw Preventing Pandemics at the Source, those kinds of coalitions that I think will be key to support in this initiative. So thank you.
Thank you. Thank you very much. Colin, over to you. If you could save me some seconds, I would appreciate it.
Sure. Thanks, Rosemary. I echo the principle from earlier that pandemic preparedness has to be built through systems that also respond to the health challenges of today. Priority for community-led systems, health workers, platforms that are responsive now and for the future. And to that end, that the fifth should prioritize the existing tools that are really doing that the most effectively and that have the credibility and equitable governance built in. And just to say that in addition to the what, I think at least as important is the how in the funding, and that the fifth should also be following the lead of these kinds of mechanisms and countries and communities on approach. In terms of consistent, reliable funding, multi-year funding, community-led design, kind of aggregate multi-country proposals that Chris referenced earlier. And finally, Bruce, you asked, you pushed for some of what the fifth shouldn't do, and happy to oblige. I mentioned a few bodies I recommend for the front of the line. I did not include the World Bank or MDBs in that list for priority for implementation. Would suggest that energy is better spent on debt relief, crowding in additional IDA resources for PPR and other truly additional sources of funding. So I'll leave it to there. Thanks, Rosemary.
Thank you. Thank you for that. Gisa, over to you.
Thank you so much, Rosemary. I want to bring in that the fund of the scope needs to make sure that it funds human rights-based responses and that human rights are at the core. We have seen and keep seeing with HIV, TB, and other pandemics that we need responses that are grounded in human rights. So let's build them in from the start. Let's not keep making the same mistakes, and my condolences to Nigel. For funding priorities, focusing on responses that respect, protect, fulfill in particular economic, social, and cultural rights, including those points analyzed by the right to science, right to health, and right to non-discrimination are of particular importance to community health and well-being. And they also address social determinants of health and points raised by others. Following Leslie's points, the fifth needs to make sure that every process they fund has community participation and that they fund civil society organizations, big and small, and not just governments or agencies. Thank you.
Thank you. Haley?
Hi, Haley Severance, NTI Bio. Preventing biological events is not only about addressing naturally occurring events, but also considering risks posed by man-made events, especially given our current gaps in our ability to safely and securely manage deadly agents, and given our patchwork approach to governing and overseeing dual-use research. We need to invest in efforts to prevent against this full spectrum of biological threats, from naturally occurring to accidents to deliberate events with potentially catastrophic consequences. Additionally, we need to shift the balance of the support to prevention as opposed to response. This is what will make the fifth a unique value add and a different way of approaching health security in a more sustainable way. A transparent, data-driven approach to resource allocation will ensure equitable distribution, not only to help those most in need, but to meaningfully reduce the risk of that an outbreak will spread globally with devastating impact. Civil society has the tools to inform this type of approach. For example, NTI Bio and Johns Hopkins, in collaboration with the Economist Impact, have developed the Global Health Security Index, a comprehensive, transparent assessment and benchmarking of health security and related capabilities across 195 countries that make up IHR states parties. These types of tools that place a premium on transparency can be used by the fifth governing board to drive priorities and create accountability. Thank you for the time.
Thank you so much. And Rabita, please, very rapidly.
Great, thanks so much, Rosemary. I'm Rabita Aziz with the Infectious Diseases Society of America. As physicians and scientists working in infectious diseases, we believe the development of global standards and minimal requirements for infectious disease surveillance and reporting is a critical component of strengthening PPR. Strengthening lab infrastructure, monitoring and response, data management and analysis, and improving supply chain management to strengthen equity are also key. The fifth must prioritize building an adequate workforce, including trained professionals in epidemiology, clinical response, One Health, data systems, and analytics. The FIF should work to establish regional centers for PPR monitoring and management and support the establishment of regional manufacturing centers to ensure affordable and equitable access to diagnostics, therapeutics, and vaccines for LMICs. Finally, we believe FIF funding should also address antimicrobial resistance, which the WHO has declared as one of the top 10 threats to human health. This includes implementing better IPC strategies, improving WASH and training healthcare workers, as well as scaling up antibiotic stewardship, while ensuring access to and appropriate use of antibiotics in settings that typically lack access. Thanks so much.
Thank you so much. And I know I see your hands, Mita, and we'll come in the next round. We've eaten a bit of time into the second discussion. So what I want to do now is to invite my colleague Jacob Eckhoff to give us a quick summary of the takeaways from this discussion. And then we'll transition to the second discussion. And Smita, hang on there. I'll start with you when we come to the second round. Jacob?
Wonderful. Wonderful. Thank you so much, Rosemary and thank you to you all for such a fantastic and engaging discussion. I think over the course of the past 30, 40 minutes or so, have seen several key themes really coming out of the discussion around priority thresholds, the importance of equity, access, and inclusion, the need for country-level investments that are critical in frontline community healthcare workforce, things like that. On that priority threshold piece, there was the call to identify the percentage allocation between the different priority areas. So really looking at like, how do we break out the importance of country level versus regional, global capacity, regional or global mechanisms to build capacity and weighting accordingly. On equity, access, and inclusion, looking at the importance of regional manufacturing for medical countermeasures, to include very important populations such as people with disabilities. And the fund should also consider how to promote equity and equal access throughout all of its activities as well. A very, very clear call for the need for country-level investments and how critical that is. These capacities should be a priority investment area, and community advocacy is important. We must advocate for an enabling environment, not just biomedical interventions, but non-pharmaceutical ones as well. There were several calls for investments in WASH and hygiene to build very critical and strong, safe health systems across the board. And that goes into the need for investment in frontline and community health workforce. So driving up funding for these groups, driving community engagement, mapping of priorities, and really looking at how to invest in that workforce and the infrastructure needs as well. There were strong calls for upstream prevention, whether that's looking at the wildlife field and spillover, or looking at how containment of a disease is not just enough. You need a thorough investment in those spillover prevention activities. Prioritization of One Health solutions and networks is another key theme that came out. And one point around the need to incorporate academia, particularly in the zoonosis sector, as it's important for disease preparedness and spillover, and looking at combining data on that animal and human interface. Several other points that were brought up were the need for good global standards for data, for surveillance and laboratory capacity, and the fund could weigh in there. The need to focus on prevention and preparedness and not just response as part of activities, and how we need to address the full spectrum of risks, whether those are naturally occurring ones or ones that are more human caused from a variety of sources. We need to prioritize knowledge sharing and collaboration, and then that data-driven approach, how to fuel transparency and accountability. Bake that in at the beginning so that it's part of FIF operations from the outset. There were also a few points on what not to do, leaning into that call from Dr. Elward. So there was a call not to fund existing World Bank multi-development banks for implementations, that we can drive more money to countries themselves. And then also some recommendations around not broadening the scope so far, that we're focusing on response and R&D, since those can often drive up or absorb or increase costs exponentially, and they have other constituencies. But broadly, some very, very key important themes that were brought up here, and I think lots to follow up on going forward. Back to you, Rosemary.
Thank you. Thank you so much for the great summary for capturing that. We'll transition quickly to discussion 2. We are focusing on initial RFP priorities. And for context, these are some of the initial priorities outlined there. And the discussion here, we'll be looking at what should the initial RFP focus on. The guiding questions for that are 2. What key priorities should define the first round of funding? What are areas that should be deprioritized for this initial round? So I think building on from the conversation we've had in terms of the focus, but then narrowing there to say, where can we scale up? Where can we close the gaps? What priorities should we put forward? So Smita from India, I want to see whether your comment can come in here, because we heard you and we had to transition very quickly. So I want to invite you first.
Sure. Thank you, Rosemary. So I would like to mention what should not be focused, like we should not focus on just numbers, because the governments focus on just numbers and they show very less number of deaths, whereas who are dying, it is the people who are vulnerable, like people with chronic health conditions, or people who are homeless, without any shelter, or people with disabilities, and many other vulnerable groups. And also we should not be focusing on any bureaucratic health decision which gives only tokenistic representation for the vulnerable communities. And finally, a strong no to inaccessible information. We heard how important it is for prevention and WASH also. So the with regard to prevention, when everybody were talking about hand hygiene during the pandemic, people with hearing impairment, the deaf groups did not understand, did not know about it until somebody translated it in sign language. So inaccessible information is a strong no. Thank you very much.
Thank you for that. So let's raise our hands. We want to keep this second discussion to about 1 minute instead of 90 seconds, because we are, we've spent quite a bit on the first discussion. So let's invite colleagues. I want to encourage colleagues who haven't spoken to please raise your hands, and also encourage colleagues from diverse regions to step in. I see you, Paul, so you have the floor, but I also want to line up a few other colleagues. I don't see any hands. Kindly also use the chat. We are acknowledging that as we go. I'm also going to encourage colleagues that I know who have been working on the FIV from the region to please step in. I see, sorry, because I'm going to mention names to see if you can come forward. I see colleagues Linda, I see Pauline Irungu, I see Donald, people who've been working here in the region and other regions. Please, we want to encourage you to step up and bring in your perspective. So Paul, I see you, John Francois. Paul?
Thank you. We are able to present a menu of investments in spillover prevention. That's sort of the neglected area. It is the key gap. It's not that there aren't, but it's one of the most neglected of gaps, right? And this menu is a set of 5 interventions that are neglected, effective, measurable, and affordable. In fact, some pay for themselves in terms of added benefits for health and human rights, poverty alleviation, climate improvement. We'd appreciate the opportunity to share that menu of 5 with the team, because in terms of sequencing, we think that these are some of the kinds of things that need to come first. It'll be almost impossible to change scope and add recipients later. And that will be, we will have created incumbents who will, we don't want to take these quick wins off the table. So here's our 3 to include in a in-scope priority alongside pandemic containment. For the first RFA, include requests to provide healthcare and livelihood alternatives to support zoonotic spillover communities to move away from environmental degradation. 2, provide support for cleanup of wet markets and reduction of wildlife trade. And 3, support the carrots and sticks, such as those implemented by Brazil and more recently Indonesia, that have either steeply or started steeply reducing deforestation and spillover risk by as much as 70%. Thank you very much for the opportunity.
Thank you, Paul. Jean-François, this segment is only 1 minute per person. It's not, is it just for me or you're not clear? I don't know if it's just for me.
The sound is
It's
not
for everyone.
That was
No,
weird.
it's not clear.
So I think that's just, he puts his comment in the chat, Jean-François. Then.
Maybe we can go to Ulrich and then Jean-François will see if yours works or you can put your comments in the chat. So Ulrich.
Thank you very much. I'm Ulrich Laser, professor in Germany and Serbia in Europe. And I think a big problem is the lack of sufficient cooperation between various NGOs which work on the same topic. So I think the cooperation between related NGOs should be rewarded in the selection process of projects. Thank you.
Thank you.
I think my mic works now.
Yes, yes, it does.
Great. So I apologize for that. So I want to just say the obvious, I think, in a way, but it's not so obvious. We should start with the countries that have the most difficulty in getting funding for pandemic preparedness and for strengthening their community health workers. And these are the countries with the biggest fiscal difficulties, and especially the poorest countries. Now, these are countries, however, will not be able to have the nicest proposal, the tidiest ones, etc. So I'm just saying that we should make sure there's a proposal on the table to support these countries with the technical assistance required to do proper planning so they can actually have their prevention needs addressed. Thanks, over.
Thank you. I see Elon there, and Caroline, you have your hand up, and we also have Nigel. Elon?
Sorry, here I am. Thanks very much. Yeah, this is Olin from Frontline AIDS. I'll try to stick to the 1 minute timeline. So just in terms of priorities for the request for proposals, it'd be important to have a strong criteria established for the selection of countries for the proposals where the funding will be allocated, and that CSOs and community groups have the opportunity to feed and form into this in an ongoing process, and also participate in the selection of the proposals when they're done. And then in terms of the actual prioritization for where the money should go, I think it would be important for the fifth, as other people have said, to sustain and scale up pre-existing infrastructure, and particularly building on existing infrastructure from other pandemic responses like HIV, and also learnings from the WHO global health strategies and the global fund operations have a focus on wider health systems rather than a narrower focus on narrow traditional primary healthcare and sort of infrastructure within primary healthcare systems to be the only or the main target of funding. Thank you.
Thank you. It was Caroline and Nigel, and I also see you, Jenny from Liberia. Caroline?
Hi, we've been mostly listening because this is a platform to invite others in, but I do think an important point that has not been stressed here is the, which links to the prior conversation, and this is prioritization of how we're going, projects that are going to incentivize countries to take ownership of the pandemic preparedness and response agenda and prevention, to really own this, to elevate it as a political priority, as a domestic investment priority. I know that's a clear priority for the fund, but how can we use not just discrete projects? It speaks to how are we addressing sort of public financial investment and planning so that this is something that is elevated and prioritized year in, year out. I know there are other many inputs from colleagues from Africa and Asia who have been part of our working groups, and I know this is an important issue for them. Thanks.
Yeah, absolutely, about catalyzing domestic resources and sustainability. Thank you. So Nigel, and then Jenny.
Yeah, thank you. Well, I strongly agree with what Carolyn was just saying. We're seeing just enormous need to get policymakers together across different ministries, different agencies in countries where there's a high risk of spillover, a high risk of outbreak spreading, and look at potential quick wins there. The other thing I wanted to say is a more cross-cutting point, as the FIF is looking at moving funds out, be looking at more innovative partners and ways to move some of this money. So a lot of the money is potentially going to go into stuff that has been done for a long time, is not working very well. We see with this pandemic, we see with monkeypox, just doing more of the same to some extent is needed, but it's not going to get to the sort of the more systemic and fundamental changes needed to reduce the risk of future epidemics and pandemics. So I would be looking to innovation competitions, less traditional partners, trying to draw out more innovative work and scale that up, give that the tools to scale up across the world and draw out some of those experiences. The work of groups like Health in Harmony in Indonesia and Madagascar, Pivot in Madagascar and others, and we can help you also with some ideas and leads in this area. Thank you.
Thank you very much. And as we come to you, Jenny, just also wanted to connect with comments that are coming in. I'll just, I think, mention to, I see from Craig Kara saying that the first order of business for the new governing board must be the embracement of the One Health concept, establishing it as a policy for funding of any PPR projects by the World Bank funds. I would be happy to represent One Health initiative regarding this critical input point. Thank you for that input. And another one, let's also borrow the country coordinating mechanism structure of the Global Fund. Applications should come from governments and civil society together, including stigmatized populations. So just to reflect on what is coming through the chat. Thank you very much. Over to you, Jenny.
I think my internet is quite unstable right now. I don't know if you can hear me.
Yes, we can hear you very well.
Go ahead, we can hear you.
We've lost, yeah. Jenny, we can hear you. You're on mute now.
Sorry about that. Internet went out. I will be quick. So just reiterating, spillover prevention as a priority, along with obviously response and preparedness. From a higher global level, One Health coalitions that are out there, the Preventing Pandemics coalitions, I think they're key. And they can have a really far global reach as well as a kind of frontline on the ground reach. And then projects and programs that fully integrate and prioritize One Health into everything that they're doing. So all of the initiatives and programs. And my last point would be again, to reiterate wildlife protection and conservation field and the frontline workers such as rangers and the frontline workers programs and projects that prioritize wildlife, as well as just a last little plug for countries like Liberia. I know people mentioned very underfunded and undeveloped countries that can really use funding to do this spillover prevention. And we are one of the major hotspots, so we really do need the support. Thank you.
Thank you very much. I see only one more hand, and I think we'll go with that, then transition to the last component. So Pauline Irungu from Kenya, you have the floor.
Thank you very much, Rosemary. These are really short ones. Just two quick ones. One is, as the FIF looks at incoming projects for financing, two things. To think about encouraging countries that neighbor each other to possibly think about coming together to have projects that are very much aligned, so that where there are pandemic spillovers, then the countries surrounding that are close by are sort of in a similar place in strengthening their health systems, so that they can all respond together, so that you don't have where one country has responded, but another one is sort of like there's crossover. Secondly, is a question: to what extent would the FIF be willing to align its resources to other funders that are doing similar work, so that the impact of the overall funding available at country level is amplified, has deeper reach, and can really strengthen health systems? Thank you.
Thank you, Pauline, for that. CISDI, I had seen your hand and then it disappeared. I see you're up again, so you have the last opportunity. CISDI.
Thank you very much, Dada. Asante sana. My point is very simple. I'm already experienced a lot of funding coming, especially for COVID-19 this last year. And 100% and 90% of the fund go to the government capacity building training, and 10% or 20% go for community, and with a limit. So I don't know, you guys, how do you guys will work with this situation? Because if the fund come to the country and 90% of the fund go for the service and training, capacity building for health worker, and the community for intervention, less percent, I don't think that it will work. So please, I had that one for my experience, and please try to say this one also, if you understand me.
Thank you.
Thank you.
Yes, thank you. Thank you so much, Said. So I will turn over to Jacob for a quick summary of the key takeaways from this conversation. Jacob?
Thank you, Rosemary, and thank you all again. Some wonderful comments, points as we worked through these, our recommendations for these initial priorities. I think sensing a lot of the same themes carrying through when it comes to working very locally and incorporating the community level into what we do. One Health and those aspects of spillover prevention, I think came up again repeatedly. But as you see on the Jam board, there are some very, very key key recommendations, priority areas that I think really came out. One is around benefits and results. So looking at how we can coordinate those investments so they have a multiplier effect. And I think it was mentioned that the global financing facility model was something to look at when it comes to that. Using action-oriented research to prioritize investments that show results quickly, and making sure that the prioritized investments have multiple and big intersecting benefits across the board. Going back to that need to invest and prioritize community needs, look to affected communities to articulate the first priorities that need to be tackled, and support community level infrastructure as part of this. We also need to prioritize country ownership and coordination. So encouraging whole of government priorities, regional collaboration, encouraging joint proposals by neighboring countries and regions to really ensure that this work it goes beyond just national borders and can really help regions and sub-regions build their collective capacities as well. The funding and work needs to be catalytic. We need to prioritize areas that will encourage countries to self-finance preparedness over the long term, so that this isn't just a one-time investment or project, but that we can have sustainability over time. Those investments need to be catalytic. And the proposed structure. So looking at the proposal structure itself, looking at the selection criteria, applications from governments and civil society together, incorporating those types of innovative ideas in the proposals themselves, so that we really ensure that country needs, the community needs are represented as those proposals work through, and make sure that we gather all of the right voices and the right people so that they're involved in the process. With that, I'll turn back to you, Rosemary.
Thank you. Thank you so much for the key takeaways. I'll now turn it over to Courtney, who will give us updates regarding the interim civil society representative for the governing board. Over to you, Courtney.
Thank you, Rosemary. We're pleased to highlight here the process that has been launched to help select two CSO representatives for interim board seats for the PPR FIF. The founding investors in the new FIFT have reached agreement that its governing board should include 2 seats for civil society organization representatives. And as we've discussed earlier on this call, this agreement aligns with many calls from CSOs around the world, yet does not reach the threshold of 3 that many organizations have been advocating for. But to help take advantage of the opportunity that we have, Pandemic Action Network, our partners CISDI, EANNASO, and the Platform for ACT-A Civil Society and Community Representatives have launched an open global call for nominations, and we're working to facilitate the selection of 2 interim CSO representatives and 2 alternates. Collectively, our global organizations have strong experience with similar processes for self-selecting civil society organizations for other global funds and initiatives. We recognize that this interim selection process is taking place on an extremely abbreviated time frame to ensure that interim CSO representatives are able to fully participate in the first governing board meeting, which is currently slated for next week, September 8th and September 9th. The deadline for submitting nominations to be considered for these interim seats had been Thursday, tomorrow, at 12 noon Eastern. In recognizing both the compressed timeline and the need for a selection committee to be able to thoughtfully review submissions, we are extending the deadline until Friday, 12 noon Eastern, for these submissions to be completed. The selected interim representatives will serve on the governing board for an interim period, approximately 6 months, and the exact time frame will be determined in accordance with the evolving board structure and what the interim seat selection process might look like for other stakeholders. So I'm pleased to end it there. I know time is short and we are over time, and we can turn to any questions if you have them.
I think, Courtney, just to flag a key input from the chat. We see the comment about the process and a proposal. Linda, this is your comment about the possibility of holding a civil society meeting ahead of the board meeting next week to discuss positions with the selected CSO reps and discuss process. And in her comment also gives like best practice on CSO selection processes. So that resource is very well received, and the proposal is right there.
Yes, thank you for that comment. And in my haste to try to allow everyone to be able to sign off since we're over time, I did neglect to say that all partners collaborating on this initial call for interim proposals are extremely committed to facilitating and helping to inform a more robust and inclusive process for a more permanent seat. So thank you for those comments, and we look forward to engaging with you on that.
Yeah, Courtney, thank you. And we note the extension of the deadline, and colleagues can continue to put in any questions, comments, or anything that they might want to express in the chat, because at this point I would, Elon, I see your hand is up.
Yeah, this is just hopefully a quick question for the room and maybe the fifth interim secretariat as well. For the 2 CSO reps who will be selected, has there been any discussion about if, particularly depending on where the reps are from, if there'll be any financial support provided to them to be able to fully carry out their role and their responsibilities within the board? Thanks.
Do you want me to thank you for raising that question. It's something we're acutely aware of. So Priya, if you have a comment, please come in.
Sure, no, I can take that question. And indeed, as in the case of other World Bank FIFs, we do cover the costs of participation of CSOs, CSO reps in board meetings. You know, that is that we do, and so you know we've been discussing that internally. And so when I say we here, I mean the FIF. So the FIF can cover the costs of CSOs participating. I mean, maybe just kind of a moment to also say though that you know, alongside that, there are also, conflict of interest policies and procedures that need to be followed, in terms of the participation of CSO reps, and then, what they need to abide by when it comes to seeking then ultimately resources indirectly from the FIF to deliver projects on the ground. So there are certain conflicts of interest policies and procedures that need to be followed. But I think on the simple question of, would CSO reps be reimbursed for participation? The answer is that is the practice in other FIFs as well. Thanks.
All right, maybe this is where I transition over to Caroline for the closing. Caroline.
Thanks, Rosemary, for your terrific moderating as always. Thanks for all the rich interventions. There's never enough time for these discussions. There was a very lively chat, so just emphasizing that we are capturing all of that. I think my colleagues are also putting a survey. You'll see the link in the chat from Autumn. So if you were not able to speak or provide written comments, or actually if you did provide written comments, even so, we'd still appreciate you putting, it's a lot for us to digest in a very quick time frame. So if you would fill out that survey with any additional points you'd like to make, and if you have any other questions, and noting there were questions earlier for the interim secretariat and for the donors. So we will do our best to capture those and ensure that we can continue to have an iterative conversation and get feedback. Thank you all, and you will please go also to our Global Pandemic Fund Action Hub that we've set up on our network, on our website, which again is, we're trying to create a source of one-stop shop, if you will, for information. So and we will provide a summary of these proceedings. So thank you again to Priya, to Bruce, to Arjun, and to all of the other contributors and representatives who also joined us in listening mode today, for being part of this conversation and for engaging. This is really important that we feel there's an open, transparent platform for these discussions, and that's what we're trying to provide, knowing that all of this is moving quickly, but we appreciate that engagement. And thank you all, and we will probably look to, we take the note about trying to weave in a call before the governing board meeting. That may be challenging, but we'll see what is possible. But we certainly will intend to reconvene these consultations after the governing board, so that can be that continued feedback loop. And in our spirit of supporting those, as Priya said, 2 representatives will also, the point is to also create a platform so we can bring a wide range of perspectives to the table. So we'll continue these conversations over the coming months, and look out for that invitation once we have set a date. Thank you all, and have a great day wherever you are.
Thank you. Thanks all.
Thank you all.